Holly, thank you for joining us today. Jennifer Hollowell created the Connect and Support the Triad group. I can't remember what month it was. Maybe it was April, maybe it was March of 2020, right when the pandemic started. And she has really created, I guess, engaged consistently every time. And this group's now, at the time we're filming this, recording this, the group's over 3,000 members. The premise of the group is to connect and support the triad small businesses. It doesn't say small businesses in there, but that's where kind of the idea came from. I'm Jason. I'm a business coach and been doing that for about 5 years. I reached out to Jennifer recently about, hey, why don't you let me help you, because they're frankly a lot of fun. Let me help you do some more interviews, because she's kind of like a one-person show, and she's very busy with her real estate work that she does. So I said, hey, I'll contribute some time each week, and let's see if we can't do some more interviews and connect with more people. So that's why I'm here doing this. And Holly, welcome you to the call today.
So my name is Holly McDonald. I run Relief Physical Therapy, which specializes in pelvic health and women's health. I say both, but everyone has a pelvic floor, and so we treat men, women, and children who have pelvic floor dysfunction and pelvic problems. So I've been a pelvic floor therapist for, wow, the numbers change now that you have the pandemic. You kind of have to add a little extra, but 7 years now. That's a little bit of a surprise that I've been doing pelvic floor work. And I've had the business since 2018 here because there just wasn't another private clinic here in Winston-Salem. I was commuting to Greensboro originally to do this work. Right. And I don't know if you remember, but back in like 2017, 2018, they were starting to do all of the work on Salem Parkway. Yep. And I thought, I do not want to commute to Greensboro. But when I tried to find some place here in Winston-Salem, there wasn't anything. And I thought, oh my gosh, there's like a desert of care that really people need this kind of, if you really need it, then you really need it. And so I just decided to go ahead and open my own clinic. And it's worked out very well.
Excellent. Excellent. So that's the first one, at least recently, that I can remember that a business started because there was road work. That's good. I like that. So why don't you educate us on what physical therapy you provide and why it's so important for the marketplace to have this resource here in Winston?
Right. So pelvic floor therapy really sort of focuses on everything in and around the pelvis, and especially paying attention to the muscles at the bottom, the pelvic floor. And those muscles help us with bodily functions. So they help us control our peeing, our pooping, sex, childbirth, all of the stuff that people don't want to talk about, all of the taboo subjects. And so because of that, people can have problems down there and not ever really discuss it with anybody, not want to talk to anybody about it, possibly not even their doctors. Statistics are that 50% of people with pelvic floor problems haven't ever even spoken to their doctor about it. They assume there's nothing that they can do, and they just kind of suffer in silence. So part of my personal mission is to try to just get some more information out to people about the fact that there is something you can do to influence how your body's working, and that it doesn't have to be embarrassing. I don't know why we've created that. Like, why is it embarrassing to talk about peeing? It's something everybody does, but in this culture in America, we don't want to talk about it at all. So it's just like a taboo subject, and trying to kind of teach people that there are things that they can do, and teach people that it's okay to ask for resources is really part of my mission.
Being able to at least read and get some education by myself before I reach out to someone might help with some, because you don't know even what the right questions to ask are sometimes.
Right, exactly. Exactly. Which is part of why I offer a free phone consult, just so that people can ask some questions, because it's good to have an idea of whether or not the things that I do might be helpful, or whether or not the condition that you have is something that's going to be influenced by pelvic floor physical therapy. So
that's right. A lot of the businesses in the Connect and Support the Triad group, would like to improve their marketing. So right. I just trying to think of a couple of things, that they might ask you if they were in on this interview too. Where are you getting most of or what are the 2 or 3 resources or directions you're getting your clients from?
Mm-hmm. So people are Googling a lot and getting information that way, because it's just as you were describing, when you're having a problem, you're trying to find kind of resources out there. So I do wind up getting a lot of my resources from Google. But unfortunately, Dr. Google is not always the most reliable information. And so I'm always kind of looking to try to direct people towards something that's a little bit more solid, a little bit more, something that they can count on a little bit better in terms of information.
Right.
Even things like WebMD has a lot of misinformation specifically about pelvic floor, which is kind of unfortunate, but it's just old, is what it is. It's not the most current information. They haven't updated it in a long time.
I see. Yeah.
Yeah.
So
Um,
Google and
yeah, so Google, some social media, right? So a little bit of Facebook. If I try to inform as on my Facebook page. Really, physical therapy as a Facebook page gives you information. Instagram, I give them people information, and a lot of word of mouth. So
yep,
that's kind
yep.
of where it comes from.
Now you mentioned we were chatting before we got started here, and you mentioned that referrals from doctors actually aren't something that happen frequently or much at all. So
Right.
can you explain that dynamic so people kind of understand why that would be the case? I think it's
Yeah.
interesting.
Yeah, well, part of it is that it's a relatively new field. So if the physicians got their degree, say 10 years ago or more, they never even were educated about the benefits of pelvic floor physical therapy, because it wasn't really a thing, or if it was very sparse. It's been around a long time. It just not widespread.
Mm-hmm.
Um, and then more recently, part of it is like the conundrum that in my field we all are kind of asking ourselves, like, why don't doctors refer to us? But I think a lot of it is they just don't really realize all of the things we can do. When I talk to even people in the medical profession and say what I do, they kind of look at me and go, oh yeah, Kegels, which is a particular muscle exercise. And yes, sometimes we do that, but there's like a whole plethora of other physical therapy things we do to address that part of the body that they're just not aware of. And unless they were to take a special class in it for CEUs or something, they wouldn't learn. They wouldn't know that they're relevant. So in other countries, it's way more prevalent. I was talking to someone recently about the fact that in Australia, it's very, very common, and there's a whole lot more. It's just a much larger industry in general, where people get pelvic floor consults as part of their pregnancy and postpartum practice, like every single time and so and people are just much more informed, I think.
Mm-hmm.
In Europe the same way. So it's just a new information for people here in America.
Certainly. So another question that comes to my mind is just thinking through the experience of working with you. What's the average length of time or frequency of visit to kind of work through and resolve some of the prevalent things that you work with?
Yeah, that's a good question. So, and unfortunately, it varies quite a bit, right? But
Yeah.
depending on the condition, I have some people who approach me and say, I started having a problem 2 months ago. And I have other people who approach me and say, I've been having this problem for 10 years. And obviously, the course of treatment for those two people might be really, really different. But generally, what we do is we plan for once a week for a little while, and you should be seeing some results within 3 to 5 visits. If you're not feeling like something is changing within 3 to 5 visits, we've got to change things up right away. And then how long that lasts may just be a few more visits. In many cases, for a simple condition, like 6 to 8 visits would be common. But if someone has a more complex issue, then it may take much longer.
How much work is being done face to face versus at home homework on the situations?
Yeah. So we talk a lot about like what the contributing factors might be to a particular condition, and where the root cause is really coming from. A lot of times, by the time they come see me, there's actually sort of several factors influencing what's going on. And so we work on addressing those. Like my sessions are 50 to 55 minutes one-on-one in-person sessions with me. So we're really trying to facilitate and make some change happen in the visit. And then homework for that is to enhance the changes that we're trying to make, but it doesn't mean that you won't make any change, even if you don't have time to do those. I try to keep things very simple and very practical. I'm not trying to give you a list of 20 exercises to do at home or you're not going to get better, because the whole plan is to make it something that's really doable for you and something that you can implement.
Yeah, that's it. And you're talking about behavior change because there's something going on that's, like you said, contributing factors.
Mm-hmm.
And there's habit or lifestyle or movement changes, I would imagine, or intuit. Maybe as well as eating habits, I guess. Do you talk about those kind of things too? Or?
Absolutely. So the pelvic floor, because of the bodily functions it controls stooling, right? Urine. So dietary habits can certainly play a role. And in many cases, people come in and don't even realize that that those particular symptoms are really related to each other. So the more we address it and the more we look at a comprehensive, holistic approach, which probably will include some suggestions for diet, some suggestions for movement, some suggestions for stress management, all of those things, but I really try to keep it very practical and doable.
How much of a factor do you see gluten playing in this?
Yeah, so generally gluten sensitivity will create, like you're saying, like not feeling well. And so my role in all of that isn't so much the gluten sensitivity, but what your physical response is to the not feeling well creates holding patterns. It creates fascia that's stuck. It creates movement patterns that are faulty because you're like guarding. And so those patterns don't necessarily instantly go away, even when you fix your diet and stop using gluten. You still have some of those faulty patterns. And that's my role, is to come in and look at the trunk and the torso, how you're moving, how you're holding your breath, all of those things to make sure that you're using your trunk and your muscles in a way that is best facilitating your bodily functions.
Yeah, that's interesting. Yeah, and he certainly, I mean, every single person watching this, we don't get together and have a beer and talk about this, like you said, but every person watching this, including myself, has been uncomfortable.
Right.
You know, and that's interesting because it's like your walking gait will change, and all your whole demeanor changes too. But that's really interesting. And then you get to a point in life, if you kind of exhibit that way of approaching it or dealing with it the same way over time, that, like you said, even when that's not prompting it, you still move that way or stand that way or hold yourself that way. And I think that's kind of interesting.
Yep. So it's about breaking down, making you aware of those patterns and breaking them down so that they don't continue to be a factor.
That you've got a pretty full calendar right now, which is excellent. So the road work that got done that turned into a business has now actually has become a fruitful business over time. So what is are there a couple of characteristics of, I don't know, mindset or maybe even symptoms or that would indicate that I should reach out to you instead of a doctor? I'm trying to think about how to ask that question, but who's an ideal client to reach out?
Right. So anyone who's having issues with bladder function problems. So anything from leaking to bladder urgency to it feels like I have to go to the bathroom all the time to it feels like I can't get going when I'm trying to go to the bathroom. And that could be urine. It could also be stool, right? So any of those kinds of issues. So if you have celiac, if you have SIBO, if you have, those types of things, constipation, I can probably help and influence those symptoms and help teach you to manage the symptoms much better. And then anyone who's been pregnant, has any kind of postpartum issues, those things can also be helped. Or anyone who's had a hard, fall on their tailbone, has chronic low back pain that doesn't seem to go away, tailbone pain that doesn't seem to go away, if you've been to the doctor and they haven't given you, been able to give you relief, but they've maybe said, oh, we're not really sure what to do, or this is the best it's going to be, then I encourage you to come to pelvic floor therapy, because there's a component that those doctors haven't looked at. It just gets overlooked. They look at abdomen, they look at thighs and legs, they might look at hips, but they don't look at pelvic floor and how the pelvic floor influences all that. So,
That's interesting. How much medication to deal with these things do you see as an issue, whereas it could have been avoided going that route with some of your approaches?
right. So, and there are plenty of people out there who just really would rather have a pill and be fixed that way. And so they don't want to kind of do the lifestyle change and the movement patterns and all of that stuff. But it can only take you so far when the problem is muscular or fascia and tissue related. And that's sort of my area of expertise as a physical therapist. I'm a soft tissue expert. So I'm looking at, the muscles, the tendons, the fascia, the ligaments, the blood vessels, and how all of those things work together, and especially how they work in the core and the trunk. So, so medication doesn't generally do a really good job of influencing that tissue, right? Medication is usually more for organ function and other types of balances.
I see.
Unless they're giving you like pain medication, which it doesn't fix anything,
What are one or two ideas or comments you'd like to share to wrap things up and I guess leave our audience with before we sign off?
Yeah, so I think that number one, please stop telling each other that it's normal to leak after you have a baby. It may happen for temporarily, but those of you that have had 3 kids and they're just like, oh, there's nothing I can do, there's absolutely something you can do. Those are muscles that can be rehabbed, just like your knee can be rehabbed after surgery, just like your shoulder can be rehabbed after surgery. So please stop telling each other and normalizing it for each other that's not a thing, because it really is something that you can address. And stop telling each other that, like, oh, I'm just going to have back pain forever. I'm just going to have tailbone pain forever. It's my SI joint. Those things are really if you're not getting good results with what you're doing right now, then you do need to find someone who can be a little bit more thorough, because there's a lot that can be influenced just by the soft tissue in the pelvis.
Thank you for that. And that just prompts another question. I'm a curious person. So, do you work alongside chiropractors with some of the work that you do?
Yeah, some of the time, yeah, absolutely.
I guess it makes sense.
It can be an excellent fit, because I specialize in the soft tissue and they specialize in the skeletal alignment. So in some cases, you can really get a lot of synergy in terms of your recovery with working with both.
What are your aspirations for the next year or two? Are you looking to grow it? Are you looking to kind of keep things solid and consistent for a while? What's your idea?
Yeah, I think it's going to be pretty short order. We're going to need another pelvic floor physical therapist, because the demand is just becoming fairly great, and we're really trying to help as many people as possible. It's just frustrating when you feel like you haven't gotten any results, and then you finally feel like, oh, well, maybe this will help me, and then I've got to wait for 3 months to get in or something like that. So yep, we're definitely looking to expand.
Excellent. Yeah, the world, well, Winston-Salem, let's start there. Winston-Salem needs more of what you provide.
Right.
So I'm glad to hear that, because as a service to the community, that's going to be a really great thing to know that you're looking to grow. So that's going to be good.
Yeah.
Excellent. Well, thanks for your time today. It was wonderful to chat, and we'll share some links and maybe even put something on our replay when I kind of do a little light edit on it. Do you want to share a phone number or website real quick?
Yeah. So you can find some more information about me at reliefpt.com, and or you can call the office here, and that's 336-414-2050.
414, what was it?
2050.
Perfect. Thank you so much, Holly.
All right, thanks. I appreciate you inviting me, Jason.
All right, we'll see you soon.
Bye.